Corey, thanks for checking in with us. I know there has been a lot of news, particularly today, from the governor. Maybe you could give us a lowdown on what's going on.
I was saying, we just heard today, as well as everyone else across the state, the governor's latest directive. This was Directive 2003-30. And this directive covers ordering all Maryland citizens to basically stay home unless they are going out for essential needs, or going back and forth to work, or taking care of essential responsibilities in the community. Of course, this was in response to the alarming number of new cases that developed overnight over the last weekend here in Maryland. And the governor is trying to be as proactive as he possibly can to lessen the spread of this very, very deadly and contagious virus. So that's just went in effect today. We're going to be holding a senior meeting at 2 o'clock once I get finished with this interview with you. We're going to be meeting together with county representatives to kind of look at what we need to do here at the county level. This takes effect at 8 o'clock tonight, so we need to get some things in place real quick.
It'd be very helpful if I could understand how we define essential needs.
One of his earlier directives, and I don't know which directive it was, did go over what that term essential and non-essential is. Now, going out by yourself and getting exercise, those things are still permissible under all of the directives. This is, I believe, the 27th or 28th directive that we got from the governor. So all of those personal type of activities, walking, jogging, are still allowed. You just can't do them in large groups. You should be doing them by yourself. I think even the Deputy Secretary of Health said today during the interview that even if you wanted to walk, let's say, with your husband, wife, significant other, that's permissible. Just do not want to see a collection of people out, playing basketball, walking in groups or biking in groups. Those are the kind of things that the governor is trying to prohibit because, again, of the nature of this particular virus.
It's a pretty high fine.
Yes, it's a misdemeanor offense, $5,000 or up to 1 year in jail. And as the governor has said many times before, he is not playing with it. They are not playing with it. We're not playing with this. It is very, very serious. People are losing their life due to this virus. So we need to take every precaution possible. And if there are people still foolish enough to engage in mass activities, then they're going to be held accountable.
Give us another update, if you would, on how many cases there are in Talbot County. If you know of the number of people that have been tested, we'd appreciate that kind of information as well.
Well, we do know that the testing up at Chesapeake College, they have tested 117 people so far. That is the mid-shore testing site. So Chesapeake College has done about 117 tests thus far. I believe that Dr. Watley reported out that they were able to get some additional tests in. So they're going to be able to go for a couple of more days, we hope, to continue that testing. Of course, right now across the state of Maryland, we know that there's 1,400 case in Maryland, 174 new cases in Maryland. But the big number is that the number of hospitalization, 353 of those persons have to be hospitalized. And of course, we heard earlier today, there have been 15 deaths. Here in Talbot County, we're still looking at the 3 positive cases that we know of here in the county. All 3 of those individuals were allowed to go home and to recover at home. And that's by and large, Dave, what we're seeing across the nation, that the mass majority of persons who contract COVID-19 will be able to recover at home without hospitalization. That's why we are stressing here in the county that you make sure that your medicine cabinets are stocked with those items that you're going to need if you need to hunker down fever-reducing medication. Make sure you have plenty of water. Just lost you, Dave. Make sure you have plenty of water, and make sure that you keep yourself hydrated. So we can't stress enough to people that if you do contract it, of course, you're going to need to make sure that you see your health provider, make sure that you are tested if possible. But the mass majority of people across the nation who get this are able to recover at home.
Okay, so is there anything else you want the community to know? Either.
Sure. You know, we will be looking today at our STR license holders. There's probably going to be some additional action from the council towards our short-term rental holders, as well as our bed and breakfast license holders. Again, we will be having a meeting at 2 p.m. today to discuss any additional steps. As you know, Dave, we put out a letter to those license holders 2 days ago, basically recommending that or urging that they not take any new registrations on. We also made it clear that anyone coming from the tri-state area, that's the New York, New Jersey, and Connecticut area, had to self-quarantine for 14 days, and that was a part of the governor's directive. Now, due to this latest directive and ordering that all Marylanders stay in their home except for essential needs that have to be met, and also limiting travel outside the state of Maryland, we're going to take another harder look at the STR legislation, and perhaps there will be some additional restrictions on that license. Again, but we're going to look at that later on today. But we're really, I can't say enough again, Dave, about the people who are working behind the scenes here. You know, we have Derek White and the YMCA. They have about 12 of our children over there of those essential workers we talked about were mission critical workers. So they are seeing about 12 to 15 or so of those kids every day, and they're taking care of those children so that the workers, the doctors and the nurses can go ahead and do the duties, which is to care for those sick individuals. So we want to certainly take our hat off to them, to Jan Willis, who is spearheading our feeding campaign. They brought in some 7,000 pounds of produce over the last couple of days, and those produce are going to be dispersed through our feeding centers. And the feeding centers can continue to operate. They are part of the feeding directive that the governor did mention previously. So those feeding centers that we have around the county will continue to operate. You can still come there and get your food. I want to, of course, acknowledge Kelly Griffiths and the school board for what they're doing to help out with those feeding centers and to make sure that those persons who need nourishment can come to those centers and get nourishment. I think, again, we're just so happy. Well, we're just so proud. Let me not say happy. We're just so proud of the dedication of the people that we have here working behind the scenes.
Thank you, Corey. I appreciate it.
All right. Thank you, Dave. I'm talking to you soon.